Came another increase in ICU admissions, now totaling nearly 5,000 across the state since the pandemic began. NBC4's Matthew Herchick spoke with a number of healthcare systems here in Central Ohio about the state of ICU departments. And Matthew, what does the current ICU landscape look like?
Well, Jennifer, we know that hospitals all across Ohio provide numbers to the Department of Health every day on new hospitalizations, patient population, and right now the state says a little more than 22% of ICU beds across the state are still available, but here in Central Ohio it's approaching a bit more critical state. As the number of patients entering Ohio hospitals across the state continues to rise, the number of available ICU beds is shrinking by the day, leading to warnings from healthcare leaders across Central Ohio.
People need to take this virus seriously. The capacity of our hospitals are the capacity of our hospitals. We're trying our best to treat everyone and do the best possible thing we can for our patients.
With another 40 ICU admissions in the last 24 hours, the Ohio Hospital Association says now just over 180 ICU beds remain open in Central Ohio's Region 4. Medical experts say not only are more people contracting the virus, more people are getting severely ill because of the virus. But hospitals have contingency plans to make more ICU beds available, and healthcare leaders are working together to make sure none becomes overwhelmed.
There's a lot of juggling that goes on, and within the state of Ohio, and specifically within our region, the four healthcare systems are always talking to each other about bed capacity and trying to help everybody out if needed.
And though places like Mount Carmel and Ohio Health have been able to manage the increased patient population, prolonged ICU illness creates additional challenges with staff shortages due to sickness of their own. Now, experts have said that therapies like remdesivir and dexamethasone have really helped minimize the symptoms of COVID-19, but those are most effective when caught in the early stages, something that is critical to keeping patients out of the ICU. Local for you in Columbus, Matthew Herchick, NBC4.